Welcome to Desert Living, where we connect you with everything that makes the Coachella Valley a wonderful place to live. Desert Living starts now. Here's Brian Gallo.
Well, osteoporosis is a condition you might have heard of watching TV, or maybe if you're not getting enough calcium to feed those bones. But is this a serious condition? Can it be prevented? Dr. David Duffner, along with Patty Ryan, are here to enlighten us on some osteoporosis information, as well as back pain. So if you're having trouble jumping out of bed, it's time to start your day and listen to this. Pay special attention because it's important, obviously. How are you?
Doing fine, Brian. How are you?
I'm great, thank you. Welcome to the show.
Thank you.
Yeah, and welcome. Thank you for being here, Patty.
Thanks.
Yeah. So what exactly is osteoporosis?
Well, osteoporosis is a weakness of the skeletal system. It's lower bone density and lower bone quality. Unfortunately, bone density peaks when we're in our 20s, and it starts declining about 1% per year. And for women, it accelerates at menopause to about 2% per year. That leads to fragility fractures, which we define as a fracture caused by low energy, a minor fall to the floor, whereas when you were younger, you might not break a bone, but when you're older, bones break. It leads to about 2 million fractures a year. About a third of those are hip fractures, and about a third of those are osteoporotic spine fractures.
Oof, it just sounds painful.
It is very painful. There's nothing hurts much worse than a broken bone.
Right, right. I know hip replacement is, it seems like every day. I mean, it's such a popular procedure now.
Right, over 300,000 a year in the United States.
Wow.
Right.
Wow. Tell me a bit more about what's the concern? Why should people be so concerned, and when?
Well, when a person has a fragility fracture, their activity is severely compromised. I became very interested in osteoporosis, not just treating the broken bones, but actually treating the underlying condition of osteoporosis about 15 years ago, when I started doing this procedure for fixing osteoporotic compression fractures. This is a new technology where if this is a vertebrae, a broken bone, we can insert this tube through a very small incision, through a tube using X-ray control, and this balloon goes into the bone, and then we use this pressurizer to create a cavity, and then we fill the cavity with bone cement. So think of it like a dentist drilling out, a cavity and then filling it with something hard. So it provides like internal support, like an internal cast. It can expand the vertebrae, and it can fill the cracks, and then that relieves the pain. So
and
this
tell me
has been
again,
a big improvement.
What is the solution, or what do you put in there? Is it
bone cement, the
bone
same material
cement
that we use for joint replacements.
Okay.
It's the same material. It goes in a liquid form, and it becomes solid very quickly in about 10 minutes.
And this is a procedure that you perform. This is fascinating.
Right.
How long has this procedure been around?
It came out in about the year 2000,
Okay.
and it's widespread now.
Okay.
But as I said, Brian, I became interested in trying to treat the underlying condition, not just the broken bone.
Right.
So that's where Patty Ryan, nurse practitioner, came into my practice, and she provides that service. So that now when we have a patient with a fragility fracture, we not only fix the bone, but we help the patient address the underlying osteoporosis.
Right, you get it from both sides.
Right.
Smart, very smart.
Well, prevention too.
And again, I think for me, that would be my biggest concern is how can I prevent this? What are the measures I need to take to make sure that I can avoid this, or at least push it back, because it's inevitable for some, right?
Right.
All right, let's get to the special offer. Looks like available for consultation at the Palm Springs office. And our special offer is if you drop our name, they're going to give you some extra special attention, as well as hopefully a discount. We'll see about that. We'll see about that. I might have gotten myself in trouble. That was my suggestion.
Well, we do have cold water available for our visitors and our guests and our patients.
Right away, as soon as they come in.
And there might be a candy dish, right?
Right, and a candy dish.
Right. You can visit Dr. David Duffner at his office located at 1180 North Palm Canyon Drive in Palm Springs. You can also call for an appointment at 760-325-8677 or find him online at duffnermd.com. Big thanks to David and Patty for being here with Desert Doctors. Appreciate it. Very informative.
Thank you, Brian.
Thanks.
Thank you so much. And we'll see you guys after the break.